Well, hello everyone again, and thanks for making the time to be with us today. I'm really happy to be joining Chanel in talking about the topic of climate justice and health equity. I think the timing could not be better for this topic. We're going to start by just sharing a little bit about the topic. I have some slides to share. I'm going to then turn it over to Chanel, and then we're hoping to spend the second half of our time together really having a dialogue. And we have plenty of questions for each other, but we also welcome and invite yours. You can either speak up during the chat or during our conversation, or put your questions in the chat box at any time. Correct me, Anna, if any of that is wrong, or if there's something we should know about using the chat box.
No, feel free to put your questions in the chat box. And if you would like to have more of a discussion back and forth with people who are participating, we can also do that as well.
Sounds great. Okay. Well, I will get started, and I'll start by introducing myself, and then Chanel, maybe I'll have you introduce yourself, and then I'll go through my section here. So as Anna said, I'm Aparna Bole. I'm a general pediatrician in Cleveland, and I'm active in environmental health advocacy locally, regionally, and nationally. I'm especially interested, of course, in issues around climate action and health equity, as well as clean air. But I really do have a passion for all things pediatric environmental health. And I will turn it over to Chanel to introduce herself.
Good afternoon, everyone. My name is Chanel Smith-Wiggum. I've been involved in environmental issues, or you can say the environmental movement, for the last 16 years, focusing on everything from renewable energy to parks. Most recently, as in last week, I transitioned into a new role, and I'm serving as the Vice President of Sustainability and Social Impact for KeyBank, working on corporate responsibility strategy. Really happy to be here with you all today.
Thanks, Chanel. Whenever I think about environmental health through the lens of being a pediatrician in Cleveland, especially this year, 2020 being the 50th anniversary of Earth Day, I think about the history of the environmental movement and the role that Northern Ohio and the Great Lakes have played in giving birth to the modern environmental movement. The picture on the left, some of you guys might recognize, is from the Lorax. The Lorax was published in 1971, and Dr. Seuss was at least in part inspired to write that book because of how dirty and polluted the Great Lakes were at that time. This is the scene where the humming fish are fleeing the dirty water. And the original line was something like, "The humming fish are seeking water that isn't so smeary. I heard things were just as bad up in Lake Erie." He changed that line 14 or 15 years later when Lake Erie was substantially cleaned up. But that was what it originally said. And then here, the picture on the right, most of us are familiar with. It's the infamous picture of the Cuyahoga River on fire that was published on the cover of Time magazine in 1969. This picture was actually taken in 1952, though, and the Cuyahoga River was far from the only body of water in the United States that was polluted enough to catch on fire. We just had sort of the dubious distinction of being the poster child for this situation. You know, I think a lot of times here in Cleveland and in Ohio, these issues around the pollution of the Great Lakes and the river on fire are sort of regarded as dark marks in our history, or maybe a little bit embarrassing. But to me, they're kind of the opposite. I feel like it's a point of pride that we were really the canary in the coal mine, or the clarion call that inspired the country to wake up to the need for environmental stewardship, and really resulted in the birth of the modern environmental movement. It was the year after this Time magazine cover was printed that Richard Nixon signed the Environmental Protection Agency into existence in 1970, and 1970 was also the first Earth Day. So just kind of thinking about our role in history and at this turning point at the intersection of climate change and health equity, I think is important as kind of a lens that I use to think about our work and our leadership. In my discipline in pediatrics, much has been made of the fact that vaccine hesitancy is now on the top 10 list of global health threats that the World Health Organization puts out every year. Well, air pollution and climate change has been at the top of that list for a very long time. And I think it's really important for us as health professionals to share information about climate change in a very hyper-local way. How does climate change actually affect the patients that we see in our clinics and in our own backyards? And so when I talk about climate change as a Cleveland pediatrician, I talk about things like air quality. You know, what does it look like for my kids with asthma to have to be told before they go to practice sports in the summertime, they need to check the air quality index. And if it's an ozone action day, it might be too dangerous for them to play outside because it could provoke an asthma attack that would send them into the hospital. What does that look like for a kid not to be able to go outside and play? More extreme and severe heat waves. What does it mean for my student athletes to be suffering through these longer and more intense heat waves, deeper and deeper into the fall too? For our youngest babies, for pregnant women, patients that I see who are directly impacted by extreme heat. The extreme precipitation events that cause things like agricultural runoff into the Great Lakes in Northwest Ohio, encouraging the growth of toxic algae that threatens the drinking water in the Northwest part of our state. What does it mean for the livelihood of our farmers and their children that our growing zones are being changed and disrupted by a changing climate, by these changing precipitation patterns? What about the fact that changing patterns of infectious disease, including the expansion of the range of disease-carrying vectors like ticks and mosquitoes, are resulting in different patterns of infectious disease here in Ohio, more Lyme disease, for instance, than we ever saw before? I think it's important too to sort of put a fine point on the fact that that air quality from climate change is an issue. So things like increased surface ozone and longer and more intense aeroallergen seasons, but also that the air pollution directly caused by fossil fuel combustion has a wide range of health effects. We often think first about the effects of this air pollution on kids and others with chronic lung disease like asthma. And it's true that asthma is exacerbated by outdoor air pollution and can be also caused by outdoor air pollution. We know that even prenatal exposure to air pollution can lead to increased risk of kids developing asthma. We also know that air pollution has much broader ranging effects than just asthma. It's not just asthma. What about birth outcomes? We know that exposure to air pollution can increase risk for preterm birth and for low birth weight, both of which are risk factors themselves for infant mortality. We know that air pollution is toxic to the developing brain. Prenatal exposure and exposure throughout childhood and adolescence can affect learning, cognition, behavior, and even sleep. And to get to the point of today's discussion, those impacts are not equitably distributed. We know that in the United States, race is the best predictor of proximity to environmental health hazards, and exposure to air pollution and climate change's health impacts are really no exception. I'll just give you a couple of examples and then go back to some of the issues that I just named in the previous few slides. So we know that, for example, proximity to both point source and non-point source or vehicular sources of air pollution is most likely to occur in minority populations, especially African-American populations, as well as low-income communities. What about the health impacts of climate change itself? So this relates to proximity to sources of air pollution. There are also many examples I could give you of inequitable impacts of climate change's health effects. Here's one. We know that historical redlining policies, so as some of you know, redlining refers to the identification in the New Deal era Federal Housing Administration rules, identification of typically minority neighborhoods as being red or high risk for investment for housing loans. And really that identification of these red line neighborhoods has resulted in systematic disinvestment in minority communities here in Cleveland, especially historically Black neighborhoods, and that persistent health disparities can be sort of traced back to this ongoing practice. And here's one example as it pertains to climate change. We know that historically red line neighborhoods have disproportionate exposure to heat. So heat island effects are worse in red line neighborhoods. And of course, as I mentioned, more severe and intense longer heat waves are one trend that we're seeing with climate change. There was also another recent piece about extreme heat and disparities in school performance that, again, is sort of another overlay around systemic housing discrimination and how it impacts disproportionate health impacts of climate change. And so going back to some of the health issues I just named, we talk about racial disparities in infant mortality and the fact that systemic racism underpins those disparities. Cleveland, I believe right now has the worst Black-white infant mortality disparity in the country. We should not be talking about those issues without talking about environmental justice kind of wrapped into it, because as I mentioned, for example, exposure to air pollution is one important determinant of birth outcomes. Also, exposure to extreme heat is another contributor to birth outcomes. School readiness is another sort of hot button pediatric health topic. What do we do about the disparities in readiness for kindergarten? What are some interventions we can make sure that we're offering to support healthy early childhood development? Again, we should not be talking about that without talking about environmental justice and clean air. So some of the health issues that we talk about a lot through the lens of health disparities, we need to make sure that we understand that clean air and climate change are kind of part of the equation there. And then at the same time, we know that we're kind of in this critical decade of action to limit so-called runaway climate change, to keep climate change under 1.5 degrees Celsius above pre-industrial levels. This is from the UN's IPCC report. The UN also talks about climate justice and this idea that climate justice looks at the climate crisis through a human rights lens. And so I mentioned that the health impacts of climate change are disproportionately distributed so that the burden falls disproportionately on historically marginalized and discriminated against populations. Also, health effects of climate change disproportionately affect children in general. So there are a lot of different sort of dimensions, but thinking about how systemic racism has results in a persistent disproportionate impact of environmental hazards on minority communities is one aspect of climate justice. Another aspect is the fact that those who are most responsible for creating greenhouse gas emissions and who profit from them are not the same populations who tend to suffer the most from health hazards. So there's sort of a health impacts of climate change and sort of like the systems that create climate change that are both important dimensions to consider when we think about climate justice. And I think it's important that we consider what we're learning from the current pandemic that we're currently still in the grips of. This sort of intersectional idea about health equity, climate action, environmental justice, how are these things intertwined? We're kind of seeing this play out in disparities around the COVID-19 pandemic. And I think it's sort of a tragic lesson that we need to learn and use to create a new normal post-COVID-19. So there are a couple ways that I would sort of describe COVID-19 through this lens. One is the disparities in outcomes from COVID-19. We're seeing that pre-existing health inequities are leading to disparities in COVID-19 outcomes, but so are environmental exposures. So we know that exposure to air pollution is one determinant of poor COVID-19 outcomes. We know that disproportionate exposure to unsafe housing during this time of quarantine can exacerbate health inequities. So in that sense, we can kind of apply an environmental justice lens to what's happening with COVID-19 outcomes, but also pre-existing economic inequities, things like housing insecurity, food insecurity, utility insecurity. Those issues are being amplified and magnified in the economic hardship that families are facing in the COVID-19 era. And so I think the way that I think about this in a very intersectional way is, the same system that created climate change, a system that's based on extraction, exploitation, consumption, and disposal, has created inequities that are now being magnified in the COVID-19 crisis. So the same system that created climate change resulted in the inequities that are being sort of amplified and kind of writ large for us in this very tragic way during the COVID-19 pandemic. So I think we were in this sort of crucible moment, right? We have this 10-year period to act on climate in a bold way, and we are being shown in sort of tragic real time how the system that created the issues that we're now grappling with was so inherently vulnerable that we put this pandemic on top of it and look at all the cracks that are exposed. So I think this sort of intersectional approach is really important. And it seems like it's complex, but I think actually what we're learning is that we're describing the same problem in a lot of different ways. So climate change, systemic racism, health equity, health disparities, environmental justice, there's sort of just different ways of describing the same systemic problem. And I'll say, I mentioned that the system is inherently vulnerable, and just to put a finer point on it, systemic racism and climate justice are intertwined. When you have a system in which people are disposable, the planet and resources are disposable as well. When you have a small group profiting from the suffering of many, when you socialize risk and privatize profit, you have a system that is vulnerable, creates inequities, and creates climate change. And this is just a sort of another, this is a piece that I wanted to cite. There are many environmental justice leaders regionally and nationally who have been really doing the work of connecting these dots for a long time. This is one example. This is an interview of the woman that leads an environmental justice organization in New York called Uprose. Her name is Elizabeth Yampierre, and she was interviewed recently, and she really talked about these links between racism and sort of colonialism and climate change and climate justice, and the importance of engaging frontline communities in designing and implementing climate solutions in a way that I found really eloquent. I think the most hopeful way of framing this information is a true one, which is that climate solutions are health solutions, right? So when we accelerate towards a clean energy economy, we reap immediate benefits in cleaner air, and all the host of air pollution related health harms that I listed that result in a bigger burden of chronic disease for the children that I take care of. We reap immediate benefits in the reduction of those health harms when we accelerate toward a clean energy economy and benefit from cleaner air. When we invest in more sustainable, inclusive, vibrant, walkable cities with safe places for children to walk, bike, and play, we reduce harm to the planet, and we immediately benefit the health of people. When we invest in safer, more sustainable food systems, when we encourage more plant-forward diets, we incur immediate planetary benefits and health benefits. So to me, it's very hopeful that the solutions we're describing to climate change and climate justice have immediate health benefits. They also, because the health harms that we just discussed being inequitably distributed, they also are health equity solutions. These are health solutions, they're health equity solutions. And the other kind of lens through which I view this situation with hope is that, the COVID-19 crisis has also taught us that we are capable collectively of coming together to take action to protect our neighbors as a community, that we make choices collectively to wear masks or distance or whatever else we've had to do to adjust to try to protect our neighbors. We've shown that we're capable of doing that, and I think that's extremely hopeful too. I mentioned before that I am actually kind of proud of the role that Northeast Ohio and the Great Lakes played in giving birth to the modern environmental movement, and that's true. And another aspect of that is that we also are some of the greatest success stories in the modern environmental movement, looking back at the past 50 years. From that sludgy water that Dr. Seuss wrote about in the Lorax, here's Lake Erie today on the left at Edgewater Park. And from that burning river that was pictured in 1969, here's Cuyahoga Valley National Park today. That is really, its biodiversity is really a testament to some of the great successes of the modern environmental movement. So I think here we are in this crucible at this turning point. As I mentioned, the river on fire in Cleveland was hardly the only river on fire, and Lake Erie was hardly the only polluted body of water back in the day, but we were the poster child or the example used to draw the country's attention. And similarly, Cleveland is a bit of a poster child around issues related to health equity. A few years ago, HBO produced this special that highlighted the disparity in life expectancy between two proximate neighborhoods in greater Cleveland, Hough being in Cleveland and sort of in downtown Cleveland, one of the so-called Greater University Circle neighborhoods, historically redlined, systematically disinvested neighborhood that has an incredible richness of culture and residents, but has really been on the receiving end of extraordinary environmental injustice and economic injustice. And Lyndhurst, just 8 miles away, this special highlighted the fact that the life expectancy difference between these two neighborhoods is 24 years. If you look at disparities in any other kind of health outcome, whether infant mortality, lead poisoning rates, maternal morbidity and mortality, asthma outcomes, you'll see similar place-based disparities between Hough and Lyndhurst and similar communities in Greater Cleveland, and also elsewhere in the United States. You know, we've started to say that zip code often determines one's well-being more than one's genetic code. Well, that is a truism that's certainly not unique to Cleveland. It's true in cities across the United States. But again, we sort of became the poster child in some ways because HBO chose to focus on Cleveland. And I'll say, just like I feel this sense of pride that we called the country to action 50 years ago in giving birth to what is today the modern environmental movement, at this moment, this turning point during the COVID-19 pandemic, at the start of this critical decade for climate action, I feel really proud that Cleveland, in some sense, has called the country's attention to these place-based health disparities that are founded on systemic racism, and that really we understand now are intertwined with the issues related to climate action, environmental justice, COVID outcomes, that they really all are related. And so I think very similarly, we can be a clarion call right now around climate justice and health equity at this kind of turning point in the next 50 years of the environmental movement. And actually, at this point, I'm going to turn it over to Chanel, who's going to speak a little bit more about her professional and personal experiences, and then we'll sort of transition to having a conversation about some of these topics.
Oh, so thank you, Aparna, for that overview and insight on the connection between climate justice and health. And I think you can't get any more clear than the data and the information that you shared. And one of the things you just mentioned was how your zip code can really determine your future. And my life is really an example of that. And so the zip code that determined my future is 45804. If you're in Ohio, you probably know that is Lima, Ohio. That's not Cleveland zip code. But I grew up in that small town on a street called Kibbe Street. In my street, my house was next to a park, but my house was also a block from a petrochemical plant, which was one of the largest petrochemical plants in the country at one point in time. And growing up near that petrochemical plant, I had one of those Power Wheels that kids have. And, you know, most of the time kids ride them outside, they're enjoying them in the outdoors. But I didn't do that because I grew up afraid of the sounds and the smells and everything that came from that petrochemical plant. And by the time I was 25, 26, I had cancer for the first time. And by the time I was 30, I had cancer for the second time. And so I've literally lived out what it means to be exposed and live within the fence line of environmental injustice and what it can mean for community health and for personal health. And my sister also battled and won the same cancer of Hodgkin's lymphoma. And so for me, environmental health really starts at your front door. And even we can even go into what's happening inside your home, as far as things like energy efficiency and also even lead. One of the things that I don't think I heard you talk about, Aparna, but in Cleveland, we have a significant issue around lead in our homes and paint chips, and even in the soil in our community. And there's been efforts afoot to remediate those issues. But as you all know, as clinicians, that those kids who are exposed to lead, they have learning disabilities. So not only are in communities of color, and I should say Black communities and Latinx communities, are they dealing with other socioeconomic barriers, but also these barriers are exacerbated by environmental health and climate health issues. One of the things that I've really been focused on during this pandemic, especially in my old job at the Trust for Public Land, is thinking about how there's 28 million kids across the country who do not have access to a high quality park within a 10-minute walk of their home. I'm unsure about you all, but for me, parks and public space have been a respite during the pandemic. They've been a time to heal and to cope with quarantining with my family and my dog, and just a place to really get away. But there's so many kids within Cleveland and across this country that don't have that access. And even if they do have access to a park near their home, it's likely a smaller park, especially smaller than some of our suburban parks. And also they are exposed to urban heat islands. And so if you visit a park in my neighborhood here in Cleveland, it's a small park, but it also lacks tree canopy. So if I go out there with my kids, or even I go out there with some of my more senior neighbors to have a conversation or just be in community with them, they could be exposed to heat issues and to high heat levels in our community. And so I just wanted to share a little bit about, my personal experience with these issues. But one of the things that Aparna mentioned is that there are some glimmers of hope in our city, and here in Cleveland, whether it's work around lead and remediating those issues, or the work around renewables in the more than 10-year effort to have wind turbines in Lake Erie. But I think what we need to really focus on in our community, which I think Aparna and I have been really trying to figure out, is how do we make the connection between climate and health, but really make it a priority for those who are in decision-making positions in our community. And that's one way how we can move forward. Here in my new role, especially in as I focus on, what is the corporate responsibility when it comes to social, racial, and environmental justice, is really how can we focus on the whole community, not just looking at neighborhood by neighborhood, but what's happening in a person's household. What are those levers of influence where we can really drive change throughout neighborhoods, but also through the city, the state, and even across the country in my new role at Key Bank. We know that all these things are issues. I mean, there's so many things that Aparna mentioned, whether it was air pollution, lack of access to green space, lack of access to renewables, but it's all rooted in systemic racism and the lack of investment in Black and Brown communities. And so you've seen lots of announcements from foundations to corporate partners to individuals who are really focused on how can we solve these systemic issues. And I think it's really appropriate to make sure that we're also focusing on not only the economic justice issues, but also the racial justice issues, and also the health justice issues, and connect all these pillars together. So I wanted to just share a personal story and really connect the dots that Aparna mentioned, and just share my own personal experience. And this is why I've really dedicated my life in the last 16 years to working on this topic, because I don't want kids to grow up in an environment to which that I grew up in, that they should have something different and they deserve something different. And so as I talk and thinking about the connection, I do have one question for Aparna, and I'm pretty sure she has a question for me. I guess, that first question is, how can we better make the connection and connect the dots between community health and climate justice? And what are some of the first steps that we can take towards justice on both ends?
Well, I'd love to hear your response to that question too, Chanel. And I appreciate your sharing your personal story, because I know that it takes some being vulnerable to put yourself out there, but it's really, I think, important for everyone to understand how personal these impacts are. So thank you. I think that from where I sit as a pediatrician, I do a lot of work with community partners on pediatric health issues, including reducing infant mortality, improving birth outcomes, improving, I mentioned school readiness. I mean, these are issues that are top of mind for anyone in pediatric health in Cleveland. And as you know, Chanel, there are a lot of community leaders who are engaged in topics. Healthy housing is another example. You mentioned lead. A lot of community leaders who are really well informed about those issues and are fighting for health equity in our city. But I would argue that there's a little bit of an underappreciation in people who are maybe grounded in a place of community health and equity, in really speaking the language of environmental justice and understanding how environmental determinants and social determinants of health are intertwined. And so I think one role that I can play is in being in community and partnership with those stakeholders who are working on these health issues. For example, there are many groups in Cleveland and leaders in Cleveland who are focused on infant mortality reduction, some phenomenal Black women-led organizations who work on infant mortality and maternal morbidity and mortality reduction. And I feel like in working in community together, they are able to speak more about environmental determinants. I've spoken with my colleagues and we've learned to speak each other's language. So I've learned a lot about systemic racism in Cleveland. I'm still a relatively new Clevelander, learned a lot about the history of housing discrimination in Cleveland. I've learned a lot from the women that lead these organizations about the language they speak around health equity and infant mortality. And then I feel that in turn, I'm able to share, like, what about air pollution? What about clean air? Like, we really shouldn't be talking about infant mortality without talking about clean air and housing in terms of environmental health. And when we talk about social determinants, let's not forget about those environmental determinants that are really deeply intertwined. And I think both of our language has shifted. And so I think it makes a difference when people coming from those different lenses, a pediatrician who's interested in environmental health is able to speak in a more accurate and thoughtful way about infant mortality disparities because of what I've learned from my partners. And I think that those partners are now able to speak up about clean air and environmental justice, I hope partly because of what they've learned from me. So I think there's an element of having these messages not just come from, like, I'm a person who is grounded in the environmental movement, but a person who's grounded in the movement around health equity and improving birth outcomes also needs to be able to speak the language of what about environmental justice, what about clean air, and what about climate change? Like, these are not abstract topics. They relate to the issue that's close to my heart, which is infant mortality reduction in this particular example. Similarly with, I talk to partners about how lead impacts neurodevelopment in children. Well, it is one determinant of neurodevelopment in children that is preventable and needs to be fixed, but so is clean air, and so are other aspects of health, climate change related health impacts, like these disparities in exposure to extreme heat. That's a learning issue too. So I just think sometimes it means connecting the dots with community partners so that whatever your perspective, you're able to infuse your advocacy with knowledge about environmental justice and how it impacts our community. And sometimes for me, it means connecting the dots at the bedside too, with families who might be asking, like, what's going on with these longer and more crazy allergy seasons? Why is this happening? Why is my kid's football practice experiencing 95-degree heat deep into the fall? What is going on? This doesn't seem right or normal, or it seems new. And so just to feel like I can connect dots with patients and parents too, I think is really important. I do think there's a lot of a sort of popular, I say sometimes it's a misconception and sometimes it's a reality that, many of our community members are grappling with day-to-day challenges. And it seems like sometimes climate change and clean air are these like really large existential, maybe abstract seeming issues. So I think a lot of people might say, well, people are so, concerned about what's going on day to day that how can we expect that this sort of global problem is something that our neighbors can really grapple with? But at least in my experience, I think there's so many powerful environmental justice leaders who are grassroots community residents who do understand how this global issue is really local and right here in our backyards. So I think it's a little bit, I think we underestimate people when we assume that, like a person that's concerned about the stresses of the day and of today and tomorrow can't somehow grapple with this global problem. Well, it's not really just a global problem, it's a local problem. And I think it's about connecting the dots and maybe even sharing some vocabulary about what's actually happening. And when people have that, they use it. And there are a lot of really effective frontline environmental justice leaders in our own community and beyond. So I would love to know your answer to that question too, since you are coming from a slightly different perspective.
Yeah, I mean, what's interesting, I think that, doing this work in Ohio for so long and our state has been definitely regressive when it comes to public policy on these issues, whether you look at House Bill 6 and the ending of the renewable portfolio standard in the state. I've really sort of taken time to really focus on the local level, the local and the state level, because I feel like in Ohio, this isn't the same for other places. In Ohio, this is where we can really drive change and really have impact on individuals in their family lives in our community. But I think I hear a little bit about what you're saying is that we also have to listen and learn from people's lived experiences, right? And so as a patient, when I come to you and I'm telling you I'm experiencing these things, like, let's have a conversation about these things that I'm experiencing. And I love that you make the connection between climate and community and what's happening in someone's personal life, because I don't think that necessarily, I don't have any data, but I'm unsure if that always happens between a clinician and patients. I definitely know when it comes to infant mortality, there's definitely data that talks about Black women being listened to as they are going through the process of pregnancy. And so I think understanding, hearing lived experiences and making that connection is definitely key to the dots. But I also think the intersectionality of all these issues are also important, right? So you can't say you care about climate justice and climate change and not see the impact and care about racial justice, or you can't care about racial justice and not see the impact and care about environmental justice and climate justice. Because if you look at the data, those individuals who are experiencing climate and or environmental justice and or health inequities, those are likely the same individuals in the same communities. And so I think what I would love for to see around the environmental movement in particular, which a movement that has, and I would say the climate movement, a movement that has been historically white and historical male, is to figure out how to really work with the communities that are that are feeling the biggest devastation around climate change. And I think that takes a level of humility, a level of reckoning of where we have been in the past as a movement, but also creating space and creating more seats at the table for people of color and others to be at the table and have that conversation. And I think that also includes clinicians and the understanding of science and using science as an argument to why our communities need an investment when it comes to these topics and these issues. So that's really how I've been, and I've definitely, now that I am in the for-profit world, as in a week and 2 days, I'm definitely focused on how can institutions at the corporate level can really leverage not only their power to use dollars and cents, but also their power to convene individuals and bring together a table of like-minded organizations who are focused on all these issues and how they can drive significant and transformative change by coming together.
Thanks, Chanel. I am going to let folks know who are on. I'm keeping an eye on the chat box, so feel free to put questions in the chat box if you have them, but I always have more. So I do have some more questions for you, Chanel. And I'm kind of trying to figure out where to begin. I guess one question I have is, I know that in a lot of the work that you've done on park access and equity related to park access, I mean, I think that topic alone could take up a whole hour or more, but I know that you've done a lot of work in connecting with community members, like being a connector between community members and institutions in projects related to urban parks. And I just wonder, when you are speaking with community members about some of the benefits, the environmental health benefits of parks, or maybe any other environmental health related intervention at the community level, like what have been some challenges in maybe connecting those dots with community members, or maybe what's worked well for you, or maybe if you want to offer an example of a specific project that you think illustrates that, I think that would be really interesting to hear a little bit more about.
Yeah, and I think it's ironic that most of the time that communities who are dealing with these issues, they have the solution for them. They just don't have the power or the resources to really drive the change. And so in my role at the Trust for Public Land, that was my job and my responsibility, was to leverage relationships and partnerships to really make change happen. And I see there is a question in the chat about partnerships and partisanship. But I do have an example. It's not a Cleveland project, but it is a project that my colleagues worked on in Seattle. Outside of Seattle, I think Aparna and you and I talked about this because you're from the area. But in this particular community where all of our cherries come from and all those sorts of things come from in this part of the country, there's this community that an immigrant community, mostly Latinx community, that simply does not trust the health system at all in their community, just because of the historic nature regarding the relationship between the community and the health system there. But at the same time, this particular community wanted a park, they wanted a green space to convene for quinceañeras, other community events, but they didn't have that. And so the Trust for Public Land worked and used our power of partnerships to work with Kaiser Permanente to really build this space in this park, in this community. And the community created this organization called Padrinos, which means godparents of the park. And they've been working with the health system to have appointments in the park, in the green space. And so they're inviting clinicians to their space where they feel safe and they feel comfortable to really address and have preventative health conversations, to do checkups and that sort of thing, dental appointments. And so it's been a really great example of how the system, Kaiser Permanente, recognize that they're not a trusted partner when it comes, not a trusted partner, but they're not trusted by the community because of the historical nature of their relationship between them and this Latinx community. But they set aside that, they showed humility by investing in this park, investing in this space, and they're going into this space to be with the community and in community. And so I think that's a really good example of the work that institutions have to do, Aparna, because I think sometimes we think a lot about what the individual needs to do. I will type the name of the location in the chat box. But I think it speaks to what institutions can do when it comes to recognizing their own power and how they can use their power to leverage communities and really to meet communities where they are. Hopefully that answered your question a little bit.
Yeah, no, that's a good example. What I like about that story, and it's just one intervention, but it illustrates a lot of different things. This idea that climate action can be related to community amenities. You have a asset that both mitigates climate change and also creates more climate resilience. It decreases heat island effects. It's an air quality improvement measure. It also is a space that builds social cohesion and builds trust with the healthcare system to allow better access to preventive healthcare. Like, what an incredible win-win-win-win. And actually, Kaiser is an institution that has recently made a pretty bold climate action pledge itself as a healthcare institution. And I really appreciate that this is an example of an active institutional leadership that hits so many different marks. I want to just get to this last question from Dr. Blanda about healthcare providers looking beyond their partisanship. Yeah, I appreciate that question. We know that the health messages about climate change really are evidence-based in being able to cut past a lot of the unfortunately partisan divisions around conversations related to climate action. Increasingly, I think what's really helpful for healthcare providers is that so many of our medical professional societies have position papers or policy statements about climate action. I think that helps us when our medical professional societies are giving us some guidance. I know the AAP has that, the American College of Physicians, ACOG, any number of others. And then also many organizations, including the AAP, including mine, incorporate, when we think about information that's related to educating voters in this election year, we always put out toolkits about child health and elections, and I'm sure that many other organizations do. It's very nonpartisan, just focused on the issues. And climate change and clean air is one of the issues that is highlighted in this year's AAP election toolkit. So it gives very nonpartisan, evidence-based information about why climate change and clean air is a critical child health issue during this election year. And I know there are other organizations who have similar resources. So that's one example. And then I also just want to give a shout out to Healthcare Without Harm, which is an organization on whose board I serve. As some of you might know, Healthcare Without Harm is focused on sustainability in the healthcare sector. And there's a growing number of hospitals and health systems engaged in climate leadership as health sector leaders. And Healthcare Without Harm is a great resource for folks who are interested in learning more, and can be a good place to refer our hospitals and health systems if we're employed physicians looking for ways to get our hospitals and health systems to engage in climate leadership. There's another question here about engaging more with the health industry. How can we support healthcare providers to use parks in health equity and healthcare? How can we partner with healthcare providers to make a local and global impact on climate change and health equity? Well, I know that Chanel will be able to share a lot about some really important work that the Trust for Public Land has been doing nationally on the issue of park access and health, both in terms of schoolyards and park installation. So I will let you speak to that, Chanel, because I think there's some really good TPL resources that you might be able to share in response to this question. I think that I'm not sure I know exactly how to answer the question about healthcare providers using parks and health equity. So tell me if I don't quite answer this correctly, but there is quite a significant movement, especially in pediatrics, which is my lens, so I'll speak to that, around sort of like this idea of prescriptions for nature or prescriptions for park access, right? It's like a national trend. In fact, in the AAP, there is a large group of clinicians that span different disciplines who have sort of like an organically formed interest group on nature and child health. We're interested in research, education, advocacy. Many clinicians I know work on advocating for park access, urban tree canopy, safe routes to school in their communities. It's something that my Council on Environmental Health recommends. We have some resources in our policy manual on pediatric environmental health that encourages pediatricians to be engaged in that type of work. There are some good examples of like walking with a doc or biking with a doc that we see in our own city, and maybe even more so. I'm more familiar with that being the norm in other cities, actually. So I think there are a few different ways. I think we could be doing more I think we still have a little bit of a siloed approach around like parks and urban planning and health professionals. And I think there are probably other ways we can work together. If I didn't answer that question completely, please chime in, but I do want to let Chanel say a little bit about TPL and parks and health, because I think you guys have some great research. Well, I say you guys, I know you're with KeyBank now, but you know, Chanel's a forever supporter of TPL, so.
Yeah. The one thing I would say, there is some local research that was done at the Sweatland Center. It may be on their website at Case Western. They did a lit review of articles that make the connection between parks and green space and health. So there's great amount of data and information that you can use to have this conversation within your own health system or within your own organization around the connection between the two. And hi, Katie, please tell Deb Yandala I said hello at the Conservancy for Cuyahoga Valley National Park. Aparna mentioned one of the programs that I've seen, and I think a lot of this work comes in programming, but also around access to parks and nature. Walk with a Doc is one of them, especially during the pandemic. What amazing time to get out to a park and have a conversation around your own personal health or community health with the doctor. But we at the Trust for, I'm still saying we at the Trust for Public Land, although I'm not there anymore. We have launched, or for many years now, we've had a Green Schoolyards program, and that program is really in connection with schools. It started in New York City, not lots of opportunity for green space in New York City, but what we found in the city was that lots of playground places were full of asphalt, making our kids vulnerable on many levels, but also vulnerable to heat islands. We also saw issues with green infrastructure in New York City, and not many opportunities for them to address combined sewer overflow and that sort of thing in their community. And also in New York City, the playgrounds would only be open for recess hours. So you would have a playground that was only open for an hour a day. And so what the Trust for Public Land did is work with New York City schools, New York City parks to create a Green Schoolyards program, where we work with the school and we work with the kids in the school to design the park. And so they design the park with landscape architects. They're part of the team. They make the argument and the pitch to their principal and to their other classmates to really design this park. And there's like a 12-week curriculum that goes along with them learning this process. And so they're learning some hard and soft skills as they are designing the park. And then that park eventually, not only is it open for recess, it's open to the community during non-school hours, so in the evening and the weekend. And so by creating greater access to that place, we're creating greater opportunities for the health benefits that come from being exposed to the outdoors, whether it's physical health benefits, and we definitely know from mental health benefits from that as well. And so I think, Katie, the biggest lesson learned is that when you are working on parks and green space and programming, you have to recognize the multiple benefits that come to it, that the multiple benefits that come with it, but also activate those benefits through programming and also park access. And I think that's one of the biggest learns that the Trust for Public Land has learned. We're not just building a park just to build a park. We're building a park to address the many socioeconomic and health issues that communities are facing. And I know right now TPL is looking to do or they're trying to figure out how to do a longitudinal study to figure out, what is the impact of that process to create the park, but also what is the impact of the community using that park in those public spaces.
If I could just add, your comment about New York City reminded me of how creative many New York City schools are being right now in using outdoor spaces to facilitate safe distancing and outdoor learning during this pandemic time. And if they can do that in New York City, I'm just going to put this out there as a wish. We ought to be able to do that here in Northeast Ohio. And when you talk about the links between parks and health, and maybe a role for the Conservancy or other organizations that are partners, boy, would I love to see more of like a health parks school partnership. I frankly am very disappointed that we have not been able to muster the resources to be creative about safe outdoor learning opportunities for especially our Cleveland Public School kids. I think it's a travesty that they are stuck inside, kids who have a disproportionate lack of access to safe places, outdoor spaces to play. My patients who are stuck at home, going nuts, don't have anywhere to play, and we have outdoor spaces that could and should be leveraged for safe outdoor learning for these kids. So I'm not casting blame here, because I recognize there's a need for resources and better partnership between stakeholders. It shouldn't all be on teachers or all on schools or all on parents, but it just seems like an asset that we are not using enough in this time of great need. And boy, New York City is like shutting down streets to use outdoor spaces for children to learn. And it just seems to me like if they can do it, we ought to be able to do it too. Mm-hmm. So I don't know, Katie, if that was a little off track, I know, but if you have anything else to add, I welcome you can unmute.
Yeah, I was gonna type and then I was like, oh, I'll just unmute. So I really appreciate hearing this conversation and engaging. I'm excited to see Joe Blanda, one of our board members here, as well, as we're really, really trying to engage in Cleveland and with the medical fields quite a bit more to find out ways that we can better support health and wellness. We have a staff in environmental education who really works on teaching outdoors. So trying to partner with those schools and how do you use your outdoor space as a classroom. So like you said, we have those resources here. In the national park, in the metro park, we have people who are really, really good at teaching outdoors. And so how do we teach some of those pieces? How do we engage that in our public schools? If New York can do it, Cleveland should be able to do it as well. And I think where we have missed a beat in some of our history is we haven't partnered as much with our medical institutions and our doctors. There is the Park RX program and the Healthy Parks, Healthy People program nationally, but I do think, as you stated before, we have the opportunity for Cleveland to really advance and to be like we are the comeback kid with the health of the river. We can be the comeback kid with health equity and climate change. And so this is a piece that the Conservancy and the National Park are really, really interested in partnering with, folks like yourselves and others to make a big change and to make some improvements for our community.
Thank you so much. I love that. And I love how you kind of restated the comeback kid story, because I totally agree. And I think a lot of what you're describing too makes me think that one aspect through an equity lens that I think is often missing from conversations about climate action and climate solutions is the issue around urban planning, which includes park access, but also tree canopy, safe streets, places to walk and play. I mean, of course, transitioning to a clean energy economy is a big piece of what we need to accelerate climate solutions. And there are issues related to equity and investment in workers and economic inclusion and just transition that belongs in that conversation. But I think when we have conversations that are, not to name one political solution, but like people talk about the Green New Deal, right, a lot, but there's nothing in there about transportation planning and cities. And so I think from an equity lens, when we think about what assets are needed in our cities, where not to, of course there are issues in rural communities as well, but where do most people live and what is often missing from the conversation? It's how urban health, urban planning, transportation, parks are important components of community-driven climate solutions in our cities. So I just think that's really important. And if we think about using an equity lens, this issue around transportation, parks, and cities is really important. And we didn't even get to a lot of these sort of intersectional issues, but we've been talking about park access, but what are some of the other consequences of privileging car commuters from suburbs and exurbs over people who actually live in cities? The absence of safe places to play outdoors is just one, but what about the absence of safe places to walk? Pedestrian fatalities are much higher in urban, historically minority communities that lack safe places to walk and privilege cars over people. So there was a really interesting recent piece from some colleagues that was published in The Lancet that I can circulate if people are interested. The authors include Phil Landrigan and Ari Bernstein, and it relates to sort of 5 simple health-based recommendations on climate action. And one of them relates to privileging people over cars in cities. And part of that relates to park access and safe places to be outdoors. So I just really liked the way you stated this issue around this intersectional issue around health equity and climate change and access to the outdoors, because I think that's an element of urban planning and equity that sometimes is missing from the climate solutions conversation. And it's one that we can really lift up in Cleveland. And I see this comment about being next to Rockefeller Park. And I talk to my patients all the time about safe parks around. And actually part of it is helping clinicians to understand where parks are in our city, because we have a big catchment area. We have patients from the near west side all the way to the eastern suburbs. I may not know where the parks are in Warrensville Heights. So having access to information about what I can tell my patients about getting outside is really helpful. And that's one obvious area of partnership with your organization. Oh yes, thank you for sharing the publication. I just want to point out really quickly, I know we're at the end of the hour. I think anyone who followed the link, that one of the links that was sent out, there are multiple Chanel Smith Wiggums on this list. And that happened to me too when I dialed in. I came up under Chanel's name. So I think like there's Chanel's up here, but there's also a couple others who are coming up under Chanel's names. I just want to point that out in case there's confusion about the comments. But I know, Anna, we're right at the hour and I want to be mindful of time. So I'm thinking we should wrap up. I did flash our contact information up at the end there. You are most welcome to contact either of us to continue the conversation. And I really want to thank Anna and the Ohio Clinicians for Climate Action for hosting this conversation, for the whole webinar series, and to everyone for joining us today. Thanks so much.